Trachoma is a severe infectious disease caused by the bacterium Chlamydia trachomatis. It stands as a leading cause of preventable blindness worldwide, particularly affecting millions in impoverished regions. This comprehensive guide explores the causes, symptoms, prevention, and treatment of trachoma to raise awareness and promote initiatives aimed at eradicating this debilitating condition. Trachoma primarily spreads through direct contact with the eyes, eyelids, and nose or throat secretions of affected individuals, or indirectly via flies that have come into contact with these secretions. The disease thrives in communities with poor sanitation, where factors such as inadequate access to clean water and crowded living conditions enhance the risk of spread. The initial symptoms of trachoma include mild itching and irritation in the eyes, progressing to more severe signs such as blurred vision, pain in the eyes, sensitivity to light, thickening of the outer membrane of the eyeball. Repeated infections lead to the scarring of the eyelid, causing it to turn inward. When this occurs, the eyelashes continuously scrape against the cornea, a condition known as trichiasis. This persistent irritation can lead to corneal clouding and, ultimately, irreversible blindness if left untreated. Preventing trachoma hinges on improving community health standards. Facial cleanliness, regular face washing, especially among children, reduces the risk of infection. Environmental improvements, enhancing access to clean water and adequate sanitation facilities helps minimize the spread of the disease. Fly control, reducing fly populations can decrease the transmission of trachoma. The World Health Organization, WHO, recommends the safe strategy to combat trachoma. Surgery. To treat the advanced stage of trichiasis, surgery is necessary to correct the inward-turning eyelids. Antibiotics. Antibiotic treatment, particularly with azithromycin, is effective in clearing infection, especially in the early stages of the disease. Facial cleanliness. As part of ongoing prevention efforts, maintaining clean faces is crucial to prevent the spread of infection. Environmental improvement. Long-term improvements in water supply, sanitation, and living conditions are vital to eradicating trachoma. Trachoma remains endemic in many parts of Africa, the Middle East, Asia, and Central and South America. It disproportionately affects rural communities, where poverty and limited access to healthcare exacerbate the spread of the disease. International and local health organizations are collaborating to implement the safe strategy comprehensively, aiming to eliminate trachoma as a public health threat by 2030. Understanding and addressing the causes and consequences of trachoma is essential for global health. Increased awareness, combined with sustained health initiatives and community education, holds the key to eliminating the disease. By supporting and implementing the safe strategy, communities and governments can work together towards a future free from trachoma-induced blindness.